performed by walking transect lines of 100 meters from the monitor in either direction and counting visible cones within a 50-meter distance on either side of the transect line.
Thank you guys for your patience. So again, my name is Chicena Mortimer. I'm a first-year graduate student in the Integrative Human Physiology Master's Program, and my faculty mentor for this presentation and for the study is Dr. Freire, and I'll be discussing a follow-up analysis on adult patients with mild to moderate COVID symptoms after immunization. So just some background. We know that COVID is a viral infection that attacks the respiratory tract, and it's highly contagious, and it's so contagious that over 5 million people have had cases of COVID, resulting in over 6 million deaths. And because this study was done in Brazil, it's also important to highlight that there were over 30 million cases of COVID in Brazil, resulting in over 665,000 deaths. So when we're researching COVID and finding these novel data regarding the effects of COVID, a lot of that focus is put on individuals with who are in the older population, those who've experienced severe symptoms of COVID. And so there's like a lacking of research in populations that are on the younger side, also experiencing mild to moderate COVID symptoms. So these people are commonly overlooked in research. And so it's also important to highlight that while we're researching the effects of COVID in these mild to moderate, people experiencing mild to moderate COVID symptoms, that they experience persistent symptoms, including like headaches or mood swings or memory loss. And so the aim of this study is to kind of follow up on those people who are young individuals, relatively young individuals experiencing mild to moderate COVID symptoms, and to see the effects of vaccination in these populations. So here is the study design for this study or this research. There was about 57 Brazilian inhabitants that performed the study, male and females. They range from 20 to 40 years of age. And I'll come back to this slide. So this study was approved, or the individuals of the study underwent informed consent, and it was approved by the Ethical Review Board. We gathered 3 parameters in question. So those were a clinical questionnaire, an MRC data, MRC dyspnea scale to quantify any respiratory distress, and pulmonary function and cardiovascular function. And so just to kind of show you guys what the dyspnea questionnaire looks like, it's like a one ranging from 1 to 4, 0 being having no difficulty breathing except for doing strenuous tasks, and then a 4 would be difficulty breathing during normal ADLs or activity of daily lives. Additionally, blood pressure was taken using a sphygmomanometer and a manual stethoscope to gather systolic and diastolic blood pressure, and respiratory or breathing frequencies was assessed just by visually looking at the inhalation and exhalation of the chest cavity. So back to this. So after these groups were gathered, they were put into 2 categories, one being the COVID group and the control group. So the COVID group at baseline was taken after about 14 to 120 days of testing positive for COVID using a PCR COVID test. And baseline data for them was taken before vaccination. 6 weeks after vaccination, they came back again, and we took the same data for this for the COVID group, and for the control group, they tested negative for COVID using a PCR COVID test as well. So here, figure 2 shows blood pressure in these populations. And so we're seeing here on the first, I guess on the leftmost or rightmost, however you vision it, this is the COVID group. And then the COVID group follow-up is right next to that. And then we have the control group and the control group at follow-up, and with systolic blood pressure being on the y-axis. And so here we can see differences between and within groups from baseline to follow-up, and then between COVID group and control groups. And so we can see no significant difference between systolic blood pressure and in this population for this test. And then, sorry about that. And then for diastolic blood pressure, again, with the same groups being on the x-axis, we're seeing diastolic blood pressure being on the y-axis. Again, no significant difference between and within groups from baseline and follow-up for diastolic blood pressure. And again, just to highlight, this data was done as a descriptive analysis. So we're just using mean and standard deviations to quantify significance. And here, again, breathing frequency with the same groups on the x-axis, and then breathing frequency was taken as breaths per minute on the y-axis. Again, showing no significant difference between and within groups from baseline and follow-up. Finally, the MRC scale assessing dyspnea was taken, same groups on the x-axis. So you guys are going to be really familiar with this x-axis by the time I'm done with this presentation. And we see dyspnea score, again, ranging from 0 to, normally rating from 0 to 4, but we just went to 2 for this on this chart. And again, using mean and standard deviations for quantifying significance. So some strengths and weaknesses of this study. Some strengths were that this is relatively one of the first studies to present data regarding those individuals who are a young population. Again, the study was done between individuals ranging from 20 to 40 years of age. Additionally, this is also a novel research regarding individuals who experience mild to moderate COVID symptoms post-vaccination. Some limitations to the study, pop them both up, is that there was a high drop in participants for follow-up data. We started with 57, and more than half didn't come back for follow-up data analysis. And again, this was a descriptive analysis that was done, so we're still awaiting statistical analyses to understand true significance between these populations. So in conclusion, after immunization, levels of dyspnea were relatively similar between both COVID group and non-COVID group and control group, and respiratory rate was also similar between these groups. And so we conclude that hemodynamic parameters in dyspnea were similar between groups, with no changes observed, no real significant changes observed after immunization. So if you guys have any questions, let me know. And this is my contact information if you guys have any more questions as well. Oh, I'm so sorry.
The individuals that you studied had COVID and they were then vaccinated afterwards. Is that correct? Okay. So are there examples in which vaccination post for other types of infection, vaccination post-infection have results or consequences associated with those?
Just to clarify, you're asking like if we took a different, I guess, disease and we had a vaccine. So for that, I wouldn't be so sure. Maybe there is. It's kind of out of the scope of my knowledge. I think a good thing to realize from this data is that with the talk of vaccination and COVID, I think a lot of people may be scared or not sure the effects that it has on them. And so this kind of like to kind of address those concerns. Mm-hmm.
All right. Good morning, everybody. My name is Mackenzie Carter. I am a graduate student in the Public Health Department, and my mentors for this project are Dr. Tisha Beeson, Dr. Abin Foytna, and Dr. Katarina Muka. And it is titled Mixed Methods Exploration of COVID-19 Vaccination Status versus Influenza Vaccine Uptake. Okay, so just a little, I'm going to provide a little bit of background today, including